You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, he says your teeth and your gums are never too bad to have the smile you've always wanted. With us, we have an expert on this topic, Dr. James Wright. Dr. Wright, welcome to the program.
Well, thank you for having me. You can call me Dr. Bo, though.
Dr. Bo, that's what your patients call you?
Yeah, most of my patients call me that.
Now, I know you brought a stack of photos, so we're going to get to as many of those as possible. But for people that don't know your practice, and we're talking about this extreme smile makeover, or as you call it, full mouth reconstruction or rehabilitation, give us a working definition. What does that mean?
Really, full mouth reconstruction is kind of a dental term, but really, it's just a combination of things. We can do a lot of different treatments, but it's really just rebuilding your entire mouth into being able to smile, being able to function, chew properly, eat the food you want to eat, things like that. It's more just kind of redoing your entire mouth. Is
it true, though? I mean, we say at the top of the show, your teeth and gums are never too bad to have the smile, really?
Correct, yeah. Pretty much any condition, if it's real bad and you think you're not fixable, your smile can be fixed. You're chewing, you can eat what you want to eat.
Now, your practice, I guess everything is done right there.
Correct,
mean, you even have your own lab. You make the teeth right there.
Yes, we do.
Tell me about this.
We have our own full service lab on site in our building. It's great. It makes everything, communication so much easier with us. We don't have to send emails back and forth with an off-site lab. Our guys, we can have our guy come into the operatory, look, and we don't have to explain the differences of what we're trying to do. Just pre-planning all the way down to the final result. We have everything on site. Some places you'll go, they'll send you off to a specialist for part of it, and then you see a different specialist for another part. A lot of these full mouth reconstructions or smile makeovers that we do, we can do it all in-house just at our office with our doctors on staff.
What unexpected joy do you get from dentistry that you didn't anticipate?
Really just my favorite thing about everything we do is at the end, when I get to see how I've changed someone's life or been a part of the change.
Okay.
They finally decide it's time to do something. They come and see us and they're shy, they're not smiling, they're not outgoing, and then you see them a month later, 6 months later. I'm Facebook friends with a lot of these patients now, and just seeing their photos from before, they're just hiding their mouth, they're never smiling, and then now you see them, a ton more selfies being posted. They're always smiling, always happy. And it's just a complete life-changing event for the patients and for me. I mean, that's what I really love, is just seeing how we can positively just be a part of that positive experience for a patient and just being a part of their life.
Now, you have one of the largest centers in all of Kentucky. Is that correct?
Yes, we do have one of the biggest practices, or bigger practices. I mean, we have our own Insight lab that's very nice, and then we have a brand new facility that's a fairly large dental operation.
And people don't like going to the dentist, right?
No, I hear
you say they like going to you.
They like seeing us after the fact, but the first time in, I hear it all the time. They do not like coming to the dentist.
How do they put it?
They pretty much always, well, 90% of the time they'll say, nothing against you, I just hate all dentists. And it always makes me laugh because I hear it a lot and we're used to it and we understand completely. No one likes being numbed up or thinking about getting a filling, having someone's fingers in your mouth. No one enjoys that. So I understand it completely.
Do you have a secret, like a little competitive thing where you're thinking, I'm going to win them over? They're going to end up liking this place.
Yeah, I mean, I've always been super competitive. I'd always want to be the best that I can be and be mediocre is not good. So I always want to be the best I can be. And if I can make them like us, like our practice,
and
that's a win.
You're big on sedation dentistry.
Yes, I love sedation dentistry just because it makes it so much easier for the patient. I mean, the big thing is, like when I first started doing dentistry, we didn't do sedation, we did filling. So we do one filling here, you'd come back 2 weeks later, do a filling over there. Now with sedation dentistry, people don't like coming to the dentist. So you come in, we get you relaxed with IV sedation or oral sedation, whatever procedure that we're gonna do. And you can literally, in one visit or 2 visits, fix everything in your mouth.
So like a year's worth of dentistry in one shot.
Oh yeah, definitely.
Now it's interesting. So you actually can make teeth in the other room.
Yeah.
Is that right?
Yeah.
Like mills and printers.
Yeah, we have.
They print the teeth?
Yeah, we have 3D printers. We have the mills to mill straight out of the porcelain. We can make titanium frameworks on site. We can do everything on site with our full service laboratory.
Now, because you own the lab, are you able to pass the savings on to the to the patient?
Yes, definitely. With our internal lab and having everything, we don't have to send out, because sometimes you send out to a lab for a crown and you get it back 3 weeks later. We don't
That's
make
how it's
everything.
typically done?
Yeah, typically
You send it out
you'll
and wait.
come in, you'll get a temporary. 2 to 3 weeks later, that dentist will get the crown back from the lab. We can do it all in-house. We don't get your permanent crown that second, but we do speed up that timeline a lot by having our own lab, and we're not shipping it somewhere and then it gets lost in freight somewhere. It's literally just walking down a hallway and handing it to our lab team.
Now, for single tooth implants, things like that, I mean, you're able to do it right there and give them maybe a tooth in some cases the same day.
Yes, we do a lot.
Right?
We do a lot of immediate treatment where someone can come in. Recently, a buddy of mine, well, it was his dad, but still friend. He had broken a tooth, and he came in that day. Front tooth, we took the tooth. We were able to take that out, put an implant in with a temporary tooth that day.
Is that right?
Yeah.
You know, I was talking to an oral surgeon. He said, Randy, there's a new breed of general dentists. They're like, even though it's not a recognized specialty, he says they're like super dentists. They learn how to do root canals. They learn how to do adult ortho. They do all these things. Do you kind of consider yourself that way?
Yeah, definitely. I mean, we do everything in-house. We do root canals, extractions. We do the clear aligners, crowns, full mouth sets of crowns, like pretty much everything in-house. So we've got experience with doing the little tiny stuff like just one little filling, cleanings, pretty much everything in-house. So the very minimalist dental work all the way to the most comprehensive dental work, we do all underneath our roof.
And at the top of the show, I said, your teeth and gums are never too bad to have the smile you've always wanted. Is that an exaggeration? I mean, what if your gums are really bad? You can still get?
If your gums are really bad, that's kind of the foundation of everything, getting that healthy. But we can always make improvements, always get you something that's gonna improve your life, gonna get you better.
Much better. Now, you brought some photos. So what are we looking at over here?
All right. Lots of photos, just some before and afters of people that we've really made some big changes.
And these are all full mouth reconstructions. I mean, complete makeovers.
Yep, complete
right?
makeovers with some are one type of treatment, some are different, some are combinations of a bunch of different treatments. But
Okay.
yep, just full comprehensive makeovers.
All right.
With this gentleman, he came in, his number one complaint was he just couldn't chew stuff anymore.
Okay.
He had a partial made, it moved around, and he just hated it, never wore it. So he's just got nothing to chew with. So he's basically just chewing with his gums, has hardly any teeth left. And he's just at a loss. He's lost a bunch of weight, not eating healthy because he can't chew anything up. And his number one thing was, I just want to be able to chew. I want to go eat a steak.
So it doesn't even care how it looks.
No, he
just
didn't
wants to
care.
eat.
He didn't care one bit about how it looked. All he wanted was to chew a steak and be able to eat what he wanted to eat.
So what did you do for him?
We did a comprehensive makeover with a combination of treatments. So now you can see he's got a full set of teeth. They don't come in and out. They're stable. They stay there. And that's the main thing. He told me he went to Jeff Ruby's, had a great steak, one of the best of his life. He hasn't had one in years. But yeah, changed his life completely. But now every time I see him, he's smiling ear to ear. He's so happy every time I see him. And he has told me how much more he smiles, how much more he talks to people, how much more outgoing he is. And that's what he's noticed. And all he came in was so he could chew. And now he's got his whole life in front of him.
So what do they like more? Like in his case, do they like what they can eat or do they like the way it looks?
Well, that's funny because almost everyone has one reason they come in. It's either I want a pretty smile or I want to be able to eat what I want to eat. Okay. So, but almost every time when we're done with the treatment, you see them again for a checkup or you see them down the road every couple months or whenever you see them again, almost everyone talks about both benefits. Yeah, It does change your smile. It changes a ton. It makes it so much better. But if you just came in for your smile, they immediately realize how much better they can chew, how much all the other things are better. So
they didn't realize how bad it was as far as eating. They're surprised at the eating part.
Exactly.
Because when you have like loose teeth, it's hard to eat, right?
Oh yeah. I mean, imagine if you have really bad periodontal disease or gum disease, whatever you want to call it. But you come in, you have some loose teeth. So every time you're chewing, your teeth move a little bit and it hurts. So you're not going to be chewing very much. You're going to kind of baby things when you're chewing. You're going to chop it up into little tiny bites so you don't get to enjoy what you're eating.
Now, we talked about this in the green room. You say that most of your patients, they've hated their teeth for years. Like a guy like this, when I'm looking at the before and after, how many years did they go around like this?
Oh, it was years. That's
like 5 years, 10 years?
Probably over 10 years.
So they're missing out on some, I mean, do you look at it that way? Like they're missing out on some good years.
Oh yeah, I mean, let's say you're 40 and this happened when you're 30. So you've lost a whole decade of your life. You've lost a quarter of your life not being able to go out and enjoy and smile and talk to people you want to talk to because you're always nervous or self-conscious of what your smile looks like. You're kind of hiding, you're always shy, not talking to people, not living the life you could be living.
Do people do this for an occasion, like getting married, kids getting married? They're single for the first time?
Yeah.
Or they've had enough because of the pain?
Yeah, I've seen it every which way. Some patients say, hey, my daughter's getting married or my son's getting married in next July, and I have to have my smile fixed by then. We've got that. And then recently had a gentleman come in because his daughter's getting married, and she said he had to have a front tooth. He's only missing one tooth. His whole mouth is healthy, but he lost.
The doctor says, you got to have a tooth to go to my wedding.
Yeah,
Okay.
and she like put her foot down and said, you have to get a tooth. Like he was a healthy guy, but he was missing his front tooth, and he did not care. He was completely fine with missing that front tooth, but she was adamant. So we were able to do one implant on him, get him a tooth in there, and the wedding is complete. And I've gotten to see some of those wedding photos, and there's a big old smiles in those. And I had another patient was recently going through a divorce, and he had bad teeth. That wouldn't smile, wasn't outgoing, and he wanted to get back into the dating world, and now he's engaged. So he's went from one extreme of he's going through a horrible time in his life. When I met him going through a divorce, no one ever wants to do that, but it happens. And he just had a lot of cavities, had a lot of things going on in his mouth that he had neglected. And just like a lot of people, he just kind of pushed it off. And then he was just trying to make himself feel better and just himself get better, just mentally, physically, everything. And he came in, we helped him out, did a complete smile makeover on him, and he's just such an outgoing guy now. He's laughing, smiling every time I see him. He's joking with the girls at the front desk, joking with me, and he's just a completely just more outgoing, just life of the party type guy now. And he's actually engaged now. He went back out in the dating world, and now he's headed down that path. He's super happy and
Are there that many
doing
people?
good.
I mean, you're a dentist, you hear it all the time, but I mean, are there that many people that really hate their teeth?
Yes, it's
Like
amazing.
It's very common?
It's very, very common. You've got millions of people in the United States living with dentures, and they hate going to the dentist. They go and they get an adjustment or a reline or something, and they're still not happy, but they don't even know that they're even candidates to do this stuff.
Okay.
So there's millions of people that have that. And then you have other people that are just living with half their teeth missing or a couple broken ones or a couple abscessed teeth just because they're nervous or afraid to go to the dentist because it's not a fun place to be.
Now, people that are missing teeth just in the back, and we've talked, you say you're going to want to get implants in the back, that it may lead to just eventual total tooth loss.
Yeah, and that's
So if somebody's missing their teeth in the back, why do something? Why not just bridges?
well, bridges, with a bridge, it's like 3 teeth that you cement on to the 2 adjacent teeth. So if these 2 adjacent teeth are perfectly fine, you're going to drill down those teeth to put a bridge on there. So you're damaging perfectly good teeth to add 1 tooth in the middle when you could just put a single implant in there, fill in that space, and get your chewing surface back and be able to chew better without damaging these 2 perfectly good teeth. So that's one of the biggest benefits of an individual implant when
Is
you
it
just
less
need one
expensive
thing.
than like a bridge in the long run?
In the long run, yes. Most bridges, they're not going to last you the rest of your life. They're going to last you 5 to 10 years, and then you're going to replace it. An implant may be the same or a little bit more expensive that first time, but it's generally going to last you a really, really long time. That bridge, most bridges that I see coming into our office are failing in 5 to 10 years, somewhere in that ballpark.
So the implant, if you take care of it, it could last a lifetime.
Yeah, definitely.
I mean, it's like it'll last as long as regular teeth.
Yeah,
If you brush them, floss them.
Yeah, if
things
you're
like
taking care of a dental implant, it should be just like a regular tooth, and it should last you for a very long time, possibly forever.
that. Okay, back to your photos. You have more photos. Let's take a look.
We got this
All right.
super sweet lady.
Oh, wow.
She came in, she said her grandkids kind of would say things to her like, why don't you ever smile, grandma, stuff like that. So she was worried about just not being able to smile and talk with her grandkids. And she really never mentioned anything over before that. It was just, that's when she kind of like sank into her, like, I want to do something about my bad teeth. is when her grandkids said something about it. And I've seen photos with her grandkids since where she's holding her grandkids and the grandkids are smiling, she's smiling, and it's just awesome to see that. So
that after looks good.
Yeah.
That's a pretty smile,
she loves it. She's absolutely ecstatic. I love it. We do a lot of pre-planning with our treatments, so we pretty much have kind of an end goal of what the smile is going to look like before we even do the treatment.
Do you show them what their smile is going to look like?
We can.
Ahead of time?
Yeah, we can. Sometimes we do, sometimes we don't. I mean, it just depends on the patient.
Now, you have technology, you say, that takes like a 3D image of them, and so your smile designers, or whatever they're called, it's like having the patient right there.
Yeah, I've always strived to be one of the most technology advanced practices anywhere. So we've got tons of high-tech technology. We always are staying on the leading edge. We've got cone beam CT scanners, so we know how much bone support you have, all those types of things. But then with technology, just facial scanners, we actually have 2 different cameras for facial scanning detection because we want to have the best.
Okay.
So these 2 are known as kind of the best, so we have them both.
So these scanners, what, just make for a better looking set of teeth?
Well,
functioning set of teeth, or what?
Yes, but what they do is they allow us to plan better. So from the get-go, when we have a consultation with you and we're just taking our pre-op records, we can take all those records and not just have a regular old picture of you. We can take a 3D scanning photo that's going to correlate your whole facial structure, the teeth, and then we can correlate that to our cone beam information and kind of mesh all that together so we can plan everything top to bottom.
And the computer makes the teeth?
Well, the computer and our designer kind of work together. They design everything, and then that's how we kind of get rolling with the design of their new smile.
Okay, great. Now, you have more photos. Let's take a look.
This gentleman came and he just thought he had dentures and that's all he was going to have offered to him. So he had gone somewhere else. They told him, hey, you need to get all your teeth taken out and do dentures. So he came to us for a second opinion. Luckily he did. So we were able to, with a combination of several treatments, be able to rebuild his mouth, and he does not have dentures that are moving around, or when he chews on something that's not flopping around, or he can laugh out loud, eat corn on the cob, whatever he wants. And he didn't even have that presented to him at the last place he went.
You save teeth whenever possible.
Yes.
You just don't remove a bunch of teeth.
No, we do everything in-house. We can fix half your mouth, put an implant on one side. We can do lots of different treatment. If you have good teeth, and it happens a lot, at least once or twice a week, we'll have a patient come in for a consultation saying, I want what that person had, and I want to do the implants and everything. And I'm like, no, you can't. Like, I can't do that for you. Your teeth are in too good a shape. You could do some braces to straighten out a couple things and just fix the 2 or 3 bad teeth that you need fixed. I can't just take out perfectly good teeth for no reason just to make you a perfect smile. Like, that just makes no sense.
You know, look, there are certain dentists that they do fillings, crowns, bridges, things like that. Then there are dentists that have training that do these big, complicated cases.
Yeah.
Is that right? And that's where you fit in.
Yeah. So I mean, I started off general dentistry, just doing fillings, crowns, extractions, all the stuff that you mentioned, and I just constantly sought out more training.
You love it? I mean, you must.
Yeah, absolutely. Yeah, I love being a part of that change of life, change of lifestyle, and just being part of making their smile better. That's the end result. Being a part of that, seeing the life-changing event of just how they come in and how they're living their lives, and hearing the stories that they tell me about how things have changed, how things are so much better, just feeling better inside, their body's not fighting off all the infections anymore, and just feeling better overall.
Okay, good. We're going to take a quick break. We come back. You still have a stack of photos. We're going to go into those. You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
Do you have anxiety or fear about visiting the dentist? At Wright Dental Center, we don't take it personally. Dental fear is a common occurrence amongst patients. Luckily, we provide patients with a solution to ensure comfortable and pain-free dentistry at every appointment: sedation dentistry. Wright Dental Center has multiple options when it comes to sedation dentistry, including nitrous oxide, oral sedation, and IV sedation. Any of these options can ensure a safe and comfortable visit to our dental office for any type of treatment. Call our office today to schedule your sedation consultation and hear how sedation dentistry can improve your patient experience.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic: full mouth reconstruction, full mouth rehabilitation. According to this, my first guest, no matter how bad your teeth and gums are, He says there's always something you can do. You can have the smile you've always wanted. With us, we have Dr. Wright, or Dr. Bo, as your patients call you. So let's take a look. What else do you have?
We have another one here. Came in, he was in constant pain, had been in pain for years, but he was just too nervous and too afraid to go to the dental office. He had a couple bad experiences, and I've heard kind of a story multiple times where he's like, that doctor put his knee on my chest and was yanking this tooth, and I mean, maybe it happened, but I've
Those
never
aren't true, are they?
I don't know. I've heard them a lot, so I think they might be. I've never put my knee on anybody's chest to pull a tooth, but I've heard it a lot of times, but it was definitely a traumatic experience. So I 100% believe that, because he was still very, very afraid to come into the dentist, very afraid to have anything done. So IV sedation helped him out a ton. It allowed him to have all this treatment done and not worry about it at all.
Okay.
Be completely relaxed throughout the procedure, wake up, not really remember it, and then he wakes up with a new smile, being able to chew. So in a day, he went from completely paranoid about coming to the dentist. We bring him back in the next time, do IV sedation. He wakes up with a smile and can chew, and life has just changed. Now he comes in, he gets cleanings every 6 months, not a care in the world. He's joking around the whole time. It's just simply awesome. I mean, completely changed his outlook on dentists. Like he hated me. He hated every dentist ever in the world. Okay. So, but now he'll see us and just life changing. Just he can smile. He's just living his life. Can chew whatever he wants to chew. And
now we've talked about this, but people with bad teeth are judged. You say unfairly.
Yeah, for sure. I mean, we've got a lot of people that'll come in and it's not just me because I'm a dentist. I mean, Hollywood. I mean, everybody. The bad guy in the movies. What do they have? They have bad teeth.
Okay.
The ugly duckling, they have bad teeth, they get braces, they grow up or whatever in the show, and then now they're the attractive person in that show. So it's kind of ingrained.
That's right, like in the movies. I mean, if you want to make somebody look poor or living on the street or a drug addict, they give them bad teeth.
Yeah.
Halloween stores make those fake clip-on teeth.
Exactly. Yeah, I mean, you take out a tooth or you lose a tooth or you have just misaligned teeth or you make them really dark with cavities and stuff like that in the movies, and then now all of a sudden that's a lesser person or whatever you want to call it. Like, it's not an educated person, they're not friendly, they're mean, just things like that. So I mean, that's kind of, it's all around you.
When you say you don't tooth shame people, what does that mean?
I don't judge people by what their teeth are. I mean, I know what you can do and how you can do things to make better. I mean, the person is the person. I mean, your teeth doesn't do that, but fixing the teeth allows that true person to come out so that the rest of the world can see that. I mean, we see patients every day that have bad teeth.
They're very insecure about that?
Very insecure. I mean, we see the extremes of insecurity because of teeth. And just to be able to talk to them a little bit in a consultation, and you can start to kind of see a little bit of that smile come out, but then when you finish treatment, you can really see that real smile come out, and it's pretty amazing.
I think you said it's hard to recognize them sometimes. That means they come back in 6 months later for some cleanings or whatever. It's like they're not even the same people.
Oh yeah, it's amazing. It changes not just their smile, but a lot of these patients aren't living healthy. They're not eating healthy. They're not going outside. They're not doing things. They're not living a full life with their friends. And then you see them, like, not only like is their smile better and they're more outgoing, but kind of their skin tone can change. They get healthier as individuals.
Is that right? Okay.
Yeah, I mean, it's completely life altering. All right, well, let me show you this next patient.
All right.
Great guy, hard worker.
Oh, wow.
Just super dude. He had some bad habits, drank Mountain Dew all day, and he just has a job where he just takes a sip of Mountain Dew and then he puts it down. And that kind of over years and years and years without going to see a dentist, it's just one of those things that can lead to a lot of cavities. And then you put it off.
That's got to be unusual, completely unusual.
I see that a lot. We see that a couple times every week.
They never smile so you don't see it? Or
yeah,
what?
you just walking down the street. He's not going to smile. He's not going to be an outgoing guy where he's smiling. He's going to be one of the people that we see all the time where they're just guarded. They're walking around like this and they smile, but they kind of hide their smile and stuff like that. So we see it every day. So take a look at this and then just see what you see in his face. I mean, it's an amazing turnaround.
Doesn't even look like the same guy.
It doesn't. I mean, it's the same exact person. Those pictures are a couple months apart, but come in with this, walk out with this in one day, and just the smile is pretty similar except for everything inside the smile. Lip lines are the same. The teeth are just completely different. He just looks like a healthier person. He looks younger, in my opinion. I mean, you can judge off the
Looks
photos.
a lot more handsome for sure.
He looks a lot more handsome, and you can bet this young man, he's out smiling and joking around with everybody and not worrying a darn thing about his teeth anymore. You know what I mean? He's not guarded anymore, not covering up. He's living his life to the fullest, and he's loving it.
What's that like when he sees, or people like this, see their face for the first time with their new teeth?
It's awesome because it's just life-changing. You see people that have never been happy in a dental office. They hate being there. They're super nervous, super uptight. And then you see someone look at it and they just smile a little bit, and then it gets bigger and bigger. And then sometimes you see tears, and sometimes they're like, oh my God, they can't look. And then they look again. It's amazing to be a part of that. That's one of my favorite things. I love doing the surgery aspects of things. That's fun and challenging and awesome. But to see the end result and see the patient and how they respond to seeing that for the first time is just, it's an amazing feeling to be a part of. And it's the same for 50-year-olds, 70-year-olds, 80-year-olds. We treat every age that you can think of, but you can have a younger look. I mean, this gentleman you're probably off if you guess his age in the before by 10 or 15 years. And then you see his after, and you're probably gonna guess a couple years under what he really is. So obviously we're not changing people's ages, but you see this smile
changes.
And you see their lip support change, and you see those line changes and just changes in the facial structure. It does make people look younger.
And you have 70 and 80-year-olds doing this, you said?
Yeah, all
These
the time.
full mouth reconstructions?
Yeah, well, that's the thing. People are living longer and longer now. If you can't chew when you're 70, you may not make it to 80. You can't digest your food properly. I mean, there's all kinds of things. If you're not chewing your food right, you're not going to feel good. If you're 80, let's say you make it 100, you have 20 more years of being able to enjoy your food. Eat corn on the cob. Eat whatever you want to eat. Live healthy and live your life to the fullest.
And you're big on sedation, so most of these people are sedated?
Yes,
at
almost.
some level?
There's some patients do not want to be sedated, and I completely understand that. They want to be aware of their surroundings at all times. But 95% probably of these full mouth makeovers that we're doing are with IV sedation.
So they're numbed up, plus they have the IV sedation?
Yeah.
And you say they have very little memory of the whole procedure.
Yeah, the IV sedation, you pretty much don't remember the procedure itself. We numb you up, you're IV sedated, so you're relaxed the whole way. And the IV sedation helps a lot with pain and sensitivity afterwards, because if you think you're gonna have a long procedure done for a couple hours and you hold your mouth open for 2 or 3 hours or a couple hours, your jaw's gonna be sore. Now, if you're IV sedation,
right?
Now your jaw and your whole body's relaxed, and you have a lot less post-operative pain, like in your jaw joints and stuff like that, where you're not in all that post-operative pain that sometimes you would have been. Even if you had a shorter procedure and only had 2 teeth fixed, you could do 6 or 8 teeth and have less post-operative pain with it.
Okay, good. Very nice. Now, final message. We're out of time completely. Somebody watching this, really bad teeth and gums. They don't know their options. They've heard what you have to say. Maybe they've gone years of not liking their teeth, but they're still skeptical or afraid. What do you say to them?
I think you just need to give us a call and schedule a consultation. We do no charge consultations for first visits.
Do they meet you?
Yeah, come in, schedule a consultation with us. You'll meet me and my team. We'll just take a look at everything. We'll talk through things with you and see what the best treatment option is for you.
Okay, good. I want to thank you for coming on the show. Good stuff.
Oh, great being here, and thank you for having me.
Thanks. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.